Hello, my name is Dr. Jeff Twidwell, Medical Director for Hybrid Medical, the makers of H100. H100 is a treatment option for acute phase Peyronie's disease. This brief video is going to describe proper application of the medication. You'll receive from the compounding pharmacy a metered dose dispenser. The metered dose means each time you turn the knob on the bottom of the dispenser, it dispenses an exact amount, a metered dose with each click. The proper dose is 2 clicks applied twice daily to the penile shaft. We recommend that you apply it to the entire penile shaft because while you can feel a plaque, there can also be subclinical abnormalities in other areas of the penile shaft as well. I recommend that you let the medication dry for at least 5 minutes. To minimize tackiness, you can rub the medication in thoroughly and again, give it time to dry. Some residual tackiness is normal. We do strongly recommend penile modeling in addition to use of the H100. Penile modeling is simply grabbing the end of the penis and pulling on stretch. I recommend that you do that 3 to 4 times per day for approximately 1 minute. This may improve success rates further. The only reported side effect thus far with H100 use has been a skin rash. It happens in a small number of patients and is usually mild and self-limited. If it's severe, medication may need to be stopped or dosage reduced. I recommend that you first speak with your prescribing provider. If there are other questions, you can reach out to us at hybridmedical.org. Also on the website, there are some useful facts and information, and feel free to consult that as well at hybridmedical.org. We wish you well in your treatment for this difficult problem. Thank you.